Today we're going to talk about counseling and self-harm. You have options. If you've tried counseling before and it hasn't helped, keep watching. I'm Angela Howard, and I am passionate about breaking the stigma of mental illness among fellow Christians. Last week we talked about self-harm, what it is and why do people do it. So if you missed that video, go back and watch it. If you or someone that you love is self-harming, you might feel hopeless, like you're just stuck in a trap that you can't get out of, no matter how hard you try. But please don't believe that lie. There are effective treatments for self-harm, so even if you feel like it's the only way that you can manage your emotions, there is hope for recovery. Ideally, the first step is to get into a psychiatrist. They'll be able to do a full health evaluation and determine if there's a mental health diagnosis and order blood work. And it's just important to really consider your full medical history and be open and honest about that. As I mentioned last week, self-harm is often a secondary symptom. So depending on the primary diagnosis, medication might be helpful in the overall treatment, but counseling is critical. You might be sitting there thinking, look, I've already tried counseling and it didn't help. I'm sorry that that has been your experience, but the good news is that there are options. And it just might be a matter of trying a different type of counseling treatment. The truth is that you'll have a better outcome when you reach out for help. So what are the options for counseling? Let's start with option number one, dialectical behavioral therapy. This is just designed to help you learn coping mechanisms that are really positive. DBT focuses on four main areas: mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness, which really helps you with your communication skills within your relationships. Option number two, psychodynamic therapy. This focuses on exploring your past experiences and emotions. This is powerful in the treatment of self-harm because so many times we have these unconscious processes that are just manifested in our present behavior and we don't even realize it. The purpose of therapy is not to dwell on the past or stay in the past, but to help us become aware of and understand the influence of the past on our present behavior. And that's powerful. Option three, cognitive behavioral therapy. This focuses on recognizing negative thought patterns and increasing coping skills. So it's more of a goal-oriented treatment that takes a hands-on, just a practical approach to problem solving. So if that appeals to you, then I would start there. Anytime that you or a loved one struggles with a mental health issue, it can impact your spiritual life. You might feel distant from God during this time of upheaval, but I want to encourage you that you are not alone. Even when your emotions are inconsistent, there's one thing that remains unchanged. Hebrews 13:8 tells us Jesus Christ is the same yesterday, today, and forever. Have you tried counseling for treating self-harm? Comment below and let me know your thoughts. I'd love to hear from you. And please subscribe to more videos. I'll be sharing some great tips and encouragement for whatever it is that you're facing, whether you're struggling with a mental illness or have a loved one who does.